The United States Senate confirmed Robert F. Kennedy Jr. as the new Secretary of Health and Human Services on February 13, 2025. The vote was 52-48, largely reflecting the current partisan divide in the chamber. All Democrats voted against Kennedy's confirmation. This includes several senators who had previously worked with Kennedy on environmental issues. The confirmation process was contentious from the start. Kennedy's nomination, announced by President Trump shortly after his re-election in November 2024, immediately sparked controversy. Democrats and health experts expressed alarm over Kennedy's long history of promoting anti-vaccine views. Kennedy has been a vocal critic of vaccines for decades. He has repeatedly made unfounded claims linking vaccines to autism. These claims have been widely debunked by the scientific community. The confirmation hearings were marked by heated exchanges. Kennedy faced intense questioning from Democratic senators about his stance on vaccines and other public health issues. In a surprising turn of events, Senate Minority Leader Mitch McConnell broke ranks with his Republican colleagues and voted against Kennedy's confirmation. McConnell, a childhood polio survivor, has been a staunch advocate for vaccination throughout his career. In a statement explaining his vote, McConnell emphasized the importance of following scientific evidence regarding vaccines. He stated that Kennedy's views on vaccines were deeply troubling and disqualifying for the position of Health and Human Services Secretary. McConnell's vote was a significant rebuke of Kennedy and his nomination. It highlighted the deep concern among some Republicans about Kennedy's qualifications for the role. McConnell's dissent, however, was not enough to sway the outcome of the vote. All other Republican senators voted in favor of confirming Kennedy. This ensured his confirmation and appointment to President Trump's cabinet. Kennedy's nomination has been mired in controversy since its announcement. His long history of promoting anti-vaccine views has drawn widespread condemnation from the medical community and public health experts. Kennedy has repeatedly claimed that vaccines are linked to autism, despite overwhelming scientific evidence to the contrary. He has also promoted the use of unproven and potentially dangerous alternative treatments for diseases like cancer. In addition to his views on vaccines, Kennedy has also been criticized for his lawsuits against the federal government. He has challenged the safety and efficacy of numerous vaccines. He has also sued to overturn vaccine mandates. These lawsuits have further fueled concerns about Kennedy's qualifications to lead the Department of Health and Human Services. Many worry that he will use his position to undermine public trust in vaccines and other evidence-based public health measures. Despite the controversy surrounding his appointment, Kennedy has vowed to lead the Department of Health and Human Services based on science and evidence. He has outlined an ambitious agenda for his tenure, focusing on improving access to affordable health care, addressing the opioid epidemic, and promoting mental health. However, it remains to be seen how Kennedy will reconcile his past statements and actions with his current pledges to prioritize science and evidence. His appointment has generated deep anxiety among public health experts. They fear that he will use his position to advance an anti-science agenda. Only time will tell what impact Kennedy's leadership will have on the Department of Health and Human Services and the health of the nation. His tenure is certain to be closely watched by both his supporters and his detractors. The stakes are high, as the decisions made by the department have a direct impact on the lives of millions of Americans.